Good evening, ladies and gentlemen, and everybody who used to view our program Beautician. Myself, Tanmoy. You were aware of me little bit how since the last 16 or 17 years. I am coming every week to talk to you. Basically, it's a pleasure to me. I have got so much of knowledge from your phone calls earlier, and you have literally guided our path on which way we should have to go. That has first been decided by your phone calls or your comments or anything else like that. So the main resources of us obviously you like you. So the last 13 weeks we have been discussing the topic, the most poignant topic probably in the world also, not in West Bengal or in India. Throughout the world, the most poignant topic is cancer. Whatever it may be, every cancer is to some extent a catastrophe to the family. The whole world will the whole world will collapse in front of that family. They have nothing to do where they will go, whom they will consult. In case of remote peripheries, there will be not so much of pathological tests even. In Calcutta, you will find some good centers where cancer tests are regularly being and the results are very good. So today's topic is cervical cancer, probably the second largest among women cancer, and it is to some extent also the second cause of fatality among women cancer. My friend and colleague Dr. Tanmoy Mandal, he is being associated with the biggest corporate multi-specialty hospital in Calcutta. He is a medical oncologist and he is coming from Tata Memorial. He has a great legacy also. So, and he talks very nicely, and patients are everything to Tanmoy. A single patient, he has at different times told that a single patient he has spent more than 1 hour, and the patients are literally so happy that they will regularly coming for checkups, and they referred so many people also. Such a good doctor, whenever you have got in front of you in your drawing room, we do hope that definitely you will make some calls to Tanmoy. Whether there is a slightest of symptoms, we have already discussed on breasts, lungs, head and neck, cervix. You will get everything on YouTube. If you just search giving on Tanmoy's names, Dr. Tanmoy Mandal, oncologist, you will find all the programs in a vivid manner. He has discussed everything. Mainly the treatment regime he has most emphasized. Today we will discuss cervical cancer, and I am just transferring the camera to Tanmoy. The rest of the things regarding cervical cancer, our motto is to prevent the cancer, spreading the awareness among lay people, specifically the outer periphery, the remotest areas of West Bengal and even in India also, as our programs are readily available on YouTube, Facebook, everywhere. So I am just transferring the camera to Tanmoy. He will speak everything in detail on cervical cancer. Tanmoy, let's start.
So, cervical cancer is the second most common cancer in females in India.
and the incidence is something in the range of around 18%. So around 15 to 18% of the females gets affected with cervical cancer, the most common being the breast cancer. If we ask the survival, so the average survival, the relative survival, that is what we call the survival for a cervical cancer, is around in the range of 40 to 45%. That means in advanced stages 5-year survival is much less, whereas in early stages the 5-year survival is much more for cervical cancer. So we need to remember that cervical cancer, if it is detected early, it's curable, and it's a disease of not the 30s, it's a disease of the 50s, 55s. So cervical cancer doesn't develop at an age of 30-35 years of age. It doesn't commonly develop at an age of 30-35 years of age, but it commonly develops after the age of 50 years. Next, if we come to the risk factors, most important risk factor is a virus by the name of human papillomavirus. So human papillomavirus is the most common cause of cervical cancer. Around 70 to 75% of the cervical cancers is due to human papillomavirus. So human papillomavirus is having many strains. So what are the strains which might be causing cervical cancer? So the common strains which are associated with cervical cancer are the strain number 16, 18, 31, 33. These are the common strains which are associated with the causality or causation of cervical cancer. So that's the most common reason for developing cervical cancer. Other causes which might be also a reason for developing cervical cancer are, one of them is early sexual exposure, multiple sexual partners, sexually transmitted diseases, the immunocompromised states like the diabetes, HIV patients. These are the other factors.
And last but not the least is smoking.
Smoking is a cause for almost all the cancers. So these are the other causes of cervical cancer. So cervical cancer, we need to remember that mostly it's human papillomavirus, but there are other factors also. So next, if we come to the symptomatology, that what are the symptoms of cervical cancer? So cervical cancer is a cancer of the females, mostly the female. It's the female genital tract. So what happens? How do the patients present? It's mostly unusual bleeding in between the periods, or even after the patient, if the patient has undergone a or has crossed menopause, then post-menopausal bleeding. That's most important symptom of cervical cancer. What are the other symptoms which might have? That the patient might have increased or foul smelling vaginal discharge, symptoms like persistent low back pain, the pain in the legs which radiates from back to the down part of the body, weight loss. These are the other symptoms of cervical cancer. These are mostly the local symptoms which
of painful intercourse.
So post-coital bleeding, that means after a sexual intercourse, if there is a strong bleeding, that is also one of the symptoms of cervical cancer. So these are the common symptoms of cervical cancer these are the local symptoms. And when the disease spreads to the other part, most common site of metastasis is the lung. So if this disease has spread to the lung, the patient commonly has cough, breathlessness, heaviness in the chest. If it has spread to the bones, there might be bone pain. If it has spread to the lymph nodes in the abdomen or in this mediastinum, there might be pain in the abdomen also. So these are the symptoms which a cervical cancer can have when it has spread to the other parts of the body. So if we come to the diagnosis part, that how do we diagnose? So most important test is a biopsy from the cervix. When a patient presents, they generally present to a gynecologist with a abnormal vaginal discharge or bleeding or postmenopausal bleeding. The gynecologist examines the patient and with a bimanual examination, and if he feels there is a growth in the vaginal area or in the cervical area, first and foremost he undergoes a punch biopsy. It's a biopsy from that cervix, which can be done under anesthesia, which can be done under mostly a local anesthesia. So they do a biopsy, and one point I mention in all the programs is that biopsy doesn't spread the cancer. So if we do a biopsy, don't be afraid that the cancer might spread to the other parts of the body because of doing this biopsy. This is a myth. I have mentioned this point in all the programs which I have done. So that's a myth. So biopsy is the first and foremost test for diagnosis of cervical cancer. The other tests what are required is mostly a CT or an MRI of the pelvis, along with a CT and of the thorax and an upper abdomen. So CT thorax plus upper abdomen along with an MRI of the pelvis, these are the other tests which are required to stage the disease. So for diagnosis we need a biopsy, for staging we need a CT thorax plus upper abdomen along with an MRI of the pelvis. So these are the tests by which we diagnose cervical cancer. So this is the way in which how we diagnose. Next comes to the treatment part. So if you ask that the treatment, mostly the disease can be an early disease, it can be a locally advanced disease, or it can be very advanced or a metastatic disease. So if it's a very early disease, there is a role of surgery. If it's a locally advanced disease, that means if it's a stage 2 to stage 3B to 4A at least. So these are stages which are based on multiple points which we see. I will not define them over here, it's not a session like that.
It's basically scientific
Discussion. So based on these, the mainstay of treatment is radiation plus a chemotherapy. So we need to remember that cervical cancer cannot be treated by surgery in most of the patients, because majority of the patients presents with this locally advanced stage where surgery is not the mainstay of treatment. In earlier days, surgery was the mainstay of treatment, but now it's not only now, even much earlier from now also, that radiation plus a chemotherapy is the ideal treatment for a cervical cancer. So we need to remember, because we see patients who have been operated with a hysterectomy for bleeding from either from the uterus or from the cervix, and they get diagnosed that it's a dysfunctional uterine bleeding.
Gynecologist persisted most of the time.
Mostly they have a dysfunctional uterine bleeding, and they undergo.
They doubt that it may cause cancer, and some tests they regularly do.
And generally it gets operated, but cervical cancer is mostly treated with radiation plus a chemotherapy. So that's the most important treatment in most of the patients, because most of the patients present.
But Tanmoy, after the age of 50, in and around 55, if any women just dissects her uterus, there will be no such headaches also, as because the childbearing age is already she has been crossed. For that reason, I don't know whether it's a safe practice or not.
So see, uterus is different and cervix is different.
Definitely.
So when you remove the uterus, the lower uterine segment or the vault of the cervix is not removed.
Definitely.
So the origin of the cervical cancer is not removed by a hysterectomy. So if you get hysterectomized, that doesn't mean that you are safe from cervical cancer. So cervix cancer mostly develops in the lower part of that. So if there is a hysterectomy patient done and a vault, an organ known as vault is there, the vault recurrences are very common, which we see. So a hysterectomy is not the treatment of a cervical cancer.
Not ideal, at least for cervical cancer.
For an endometrial cancer, that's an ideal treatment, but it's not for a cervical cancer. So we need to first establish that whether it's a cervical cancer or whether it's an endometrial cancer, because both are different entities in together. So this is the treatment for a locally advanced stage, and for advanced stages, what we do, if it's a spread to other organs, the survival is not so great. treatment is mostly systemic. It's not a curable stage. How do we treat is that we treat it with chemotherapy. In certain patients we might add targeted therapy, and of course in certain subsets or certain populations there is a role of addition of immunotherapy. The data of
Tanmoy,
immunotherapy is
basically,
very new.
if we get some time, we would like to discuss something about immunotherapy and targeted therapy. So many questions are there. People are, regardless on age and sex, they are asking for what the kinds of treatment, basically immunotherapy and targeted therapy. If we just get some 3 to 4 minutes of time, you please tell them what is immunotherapy and what is targeted therapy, and what's the difference between these two.
Okay, so we will just discuss regarding the preventive modalities of cervical cancer, and at last I will discuss regarding this immuno and targeted therapies. So how do we prevent? So as human papillomavirus is the most common cause of cervical cancer, so HPV vaccination is the mainstay of prevention, and now in our universal immunization program schedules also it has been encompassed. So now each and every female
has been
child,
included.
yes, it
And
has
government
been
has encouraged.
encouraged.
Government has encouraged
So-
earlier during the interim budget. They have given some relaxation also.
Yes, so nowadays any child, any female child who is born, she gets vaccinated by this human papillomavirus
From 9 to
vaccine. 14 years. So that's the age of vaccination. The preventive methods are safe sexual
And
practice.
everywhere it's readily available. HPV vaccination everywhere, in the villages, in the remotest villages.
Also it's available. So safe sexual practices, prevent multiple sexual partners, to avoid very earlier age of sexual exposure, and of course to maintain a sexual hygiene, proper sexual hygiene. These are the
That's
modes
very
of
important.
prevention of cervical cancer.
In case of head and neck, the mouth hygiene and that sexual hygiene, or
in
sexual
case of cervical
hygienic practices.
in the
Cervical
cervical cancer. So these are the ways in which we can prevent cervical cancer. Next comes what are the challenges in this prevention, because we don't see that much amount of cervical cancer being prevented. The most important challenge is the cultural and the social barriers which we have, stigmas which we have. Next is the human papillomavirus vaccination, which has now been incorporated. Probably in future
Women
it
are
might
so
be.
shy on themselves that they will never disclose regarding these disadvantages, regarding these painful menstruations or anything else like that, or bleeding, or foul odor, or white discharges.
Yes.
They never will complain. They will hide everything. But if you just hide this, there is a greater chance that you may have to die from cervical cancer. If it is the earliest, intervention is possible on the earliest, then there is a chance of getting cured wholly.
Yes. Cervical cancer is generally presents mostly in localized and locally advanced phases. They are curable in most of the time. So we need to be aware, we need to remove those social stigmas and present to their treating doctors or treating physicians, whomever you consider. So that's one of the thing. And just 1 or 2 points regarding screening. Pap smear is one of the tests which you can do for
That is
screening.
also readily available in the remote
areas
parts.
also. Another test which has been advised is visual inspection with acetic acid. It's a indigenous test which has been developed for developing countries like India. So
And it's probably a low cost test.
it's a low cost test which can be done that with the use of acetic acid and doing a local examination of that areas we can do. So with this I think we can end this cervical cancer, and certain points regarding targeted therapy and immunotherapy which we will discuss now. So a cancer or a tumor can have targets. What may be the targets? Suppose a lung cancer has a target like a EGFR. Well, breast cancer has a target like HER2, HER2 or estrogen receptor. So these are the targets in certain cancers. So similar type of target, one of these target is PD-L1. So these are nothing but biomarkers. These are biomarkers. So any drug which specifically targets these are known as targeted therapies. So see, if an EGFR gene is expressed in your tumor, an anti-EGFR therapy will cause death of those cells. So an EGFR expressing
to kill
tumor
those cells, abnormal cells, behaving abnormal cells, is epigenetic. You are not basically
these are all epigenetic changes. These are not. This is not from your birth. This is not the genes which
the people mostly, rarest, most people do not inherit cancer or diabetes or anything else like that. It's all are epigenetic.
So what happens is, if you have a target like EGFR, an anti-EGFR therapy will target that tumor and will do a cell kill. Similarly, if you have a HER2 positive breast cancer, anti-HER2 therapy will target and will have a cell kill.
Specifically, you will target that particular gene.
So the similar manner in which we have lymphomas or the tumors in the glands, CD20, an anti-CD20 will target and will kill. So these are the ranges of targeted therapy. In the similar way, if a patient or if a tumor expresses PD-L1, so that is a PD-L1 expressing tumor. So anti-PD-L1 therapy will target and will kill those cells. So anti-PD-L1 therapy or an immunotherapy is also indirectly a type of targeted therapy. What are the other targeted therapies we have? Like an anti-EGFR therapy, like osimertinib, gefitinib, afatinib. These are all also targeted therapies. These are small molecules, but these are targeted therapies. A targeted therapy like VEGF, VEGF inhibitor, vascular endothelial growth factor inhibitor, like a bevacizumab is a targeted therapy used in certain malignancies. Similarly, we have HER2 as a target, anti-HER2 therapy like trastuzumab, like pertuzumab, like TDM1. These are all targeted therapies against HER2. We have target like CD20, so anti-CD20 like rituximab is a targeted therapy for the CD20 positive cells. So it's a big long list of such targeted therapies which are available. So what are the benefits of using these targeted therapies? The bystander effect, or that means there when we use chemotherapy, it kills the normal cells, it kills
as
the
well
cancer
as
cells also. But when you use a targeted therapy, it mostly affects the cell which is expressing that target, that means the cancer cell only. So the side effect is much lesser with targeted therapies. Mostly the bystander, the normal cell kill is much less. Hence the cytopenia or the WBC count, decrease in WBC count, decrease in hemoglobin, decrease in platelets, these are not so common with targeted therapies. So immunotherapy is also a type of targeted therapy, but remember only one point, that immunotherapy is targeting the cancer immune system within our body. When a cancer develops in our body, the cancer
this
cells
is basically
only
causing like a self-defense.
Yes. So the cancer also has a defense mechanism within our body to prevent being killed from the drugs which we use. So this is the cancer immune system which has developed within our body. So if an immunotherapy is an agent which kills that immune system within our body, which leads to more amount of cell kill.
And immunotherapy makes us more powerful against cancer.
So these are the subtle differences between an immunotherapy and a cancer therapy. Immunotherapy is a newer form of treatment. The side effects are much less. The side effects are not like the chemotherapy.
So our time has just passed from our hands. The clock just told that we will have to leave studio. Hence, Puja is knocking on the door. Hopefully, will be very nice. Enjoy Puja, and we will meet you next time. Bye bye. Good night.